Hi, I'm Loren, and today we're going to do a little demonstration as to how to hand express your colostrum. So you can do this from about 36 weeks of pregnancy, but just make sure you check with your midwife or a health professional first. And you want to start getting into a bit of a practice with this. So maybe starting a couple times a day, and then eventually you can build up to 4 to 5 times a day for about 15 to 20 minutes each time. So to do this, make sure that you've got a nice comfortable area, relaxing area. The lighting is soft, you've got relaxing music. You just want to make sure you feel safe and really comfortable in order to get that oxytocin going and start getting that colostrum out for baby. So before we start, just making sure that you've got perhaps a little teaspoon, a clean teaspoon nearby, and your syringe to collect your colostrum. So you might get only a small amount to begin with, or you might not get anything to begin with. So don't worry about it. Just make sure that you keep the practice going. So the more oxytocin you get pumping through the system, the more chances you have of producing colostrum and then getting the milk coming in after baby's born. So let's begin. So what you want to do first is just start massaging the breast really, really gently, a really loving touch. So you can just kind of squeeze it, gentle squeezing around, or perhaps a little bit of a knuckle roll. Whatever you do, try not to pull on the skin because that might make the breast a bit sore. So just really gentle, loving touch, gentle nipple stimulation. And this is what's going to get that oxytocin, that love hormone going. So you really want to just bring it in. It's mimicking that skin to skin that you're going to have with baby, which also gets oxytocin going. So it's just skin to skin, hand to breast, really lovingly. Beautiful. And once you're ready, we're going to start our hand expressing. So getting your thumb and first finger in this sort of C shape and then bringing them around the nipple so they're all in line, thumb, nipple, and finger. And then we're going to walk the hand back 3 fingers times. So that's the 1, 2, 3. So past the areola and then onto the breast tissue. Once you get to the breast tissue, have a little feeling where it starts to feel a little lumpy. That's where your milk ducts will be, and that's the sweet spot that we're looking for. So once you've found this place, push back towards the breastbone and then compress and release. Compress and release. Compress towards the areola and release. Perfect. And this motion brings that breast forward to encourage the milk to come through and out of the nipple. So once you've done that a few times, maybe changing the size of your C shape. So nipple, areola, breast tissue. And again, pressing back towards the breastbone, compress and release. Compress and release. Compress and release. So maybe after 5 minutes or so, if anything's come through, this is where you can use that little teaspoon just to collect the tiny little droplets that might have come through. Then once it's on this teaspoon, you can bring it into your syringe. It's one way of collecting it, which for many is a little bit easier than taking the syringe right to the nipple. And once you've done the 5 minutes on one side, again remembering that maybe nothing's come through, and that's absolutely fine. Just come straight onto the other side. And again, preparing the breast just like we did earlier. So gentle massages, really loving touch. Breathing in and exhaling. Beautiful. Gentle nipple stimulation. And then from here, a C shape to the nipple, areola, to the breast tissue, pressing back towards the breastbone. Compress and release. Compress and release. Compress and release. Compress and release. Changing sides. compress and release, compress and release, compress and release. And again, collecting those tiny droplets into our spoon and then bringing them back into the syringe. Leave it at that. Whatever you've collected in your syringe, make sure that you date it, that you pop your name on it and your hospital number, just so that way you've got all the info as soon as you can, making sure that you seal it. And you can pop this in the fridge for up to 24 hours so you can keep filling it up the next day perhaps, or later on that day. Just make sure you put it towards the back of the fridge where it's at the coldest. And once it's been 24 hours since you started one syringe, you pop it in the freezer. Again, making sure that it's named, dated with your hospital number. Maybe keep a log of where your syringes are and make sure that everyone who will be present in your birth experience and process are aware of where they are, just so that way when the time comes, there's no confusion. They can be found very easily, taken to hospital if that's where you're having your birth. And that's it to begin with. So hopefully that's been helpful. I will put together a little leaflet because you might find that it's a lot of information to take in, and I can get that sent to you should you want to have a bit more information. If you have any questions, please do let me know. Thank you.